warnings issued to individuals sitting on benches and the like. But we did have 3 tickets also issued by law enforcement. 2 were for individuals playing on a fenced soccer field. There seems to be a recurring theme there because the other ticket was given to someone playing golf on a soccer field. Don't get it. Okay, but as always, we much prefer education over enforcement. I'd like to salute our bylaw enforcement folks because they really do push for education. But when violations are blatant, we have no choice but to educate those bank accounts when it's appropriate. By the way, today also marks the first day that curbside pickup is available to any business that has a street-facing entrance. Businesses must follow public health measures and should review the workplace safety guidelines. Things that we know: promoting physical distancing and frequent hand washing, sanitizing surfaces, installing physical barriers, staggering shifts, and using various payment options to stop the spread of COVID-19. Finally, it was also announced over the weekend that provincial parks will reopen today, though beaches, camping areas, and playgrounds will remain closed, and physical distancing must be maintained. We continue to work with the province and local health authorities on what London's plan for reopening will look like. Again, I want to acknowledge the Middlesex-London Health Unit for that, for the working with them. But regardless of what reopens and when, we must absolutely commit ourselves to continue with our physical distancing and enhanced hygiene measures. I can't stress that enough. If we abandon these principles, none of what we've achieved over these last 8 weeks matter. Please, let's not allow that to happen. So those are my comments, and perhaps I could turn it over to Warden Cathy.
Great. Well, thank you very much, Mayor Ed, and it's great to be with you on this wintry Monday afternoon in May. It cannot go unnoticed that yesterday we celebrated Mother's Day. And of course, that's a day that's set aside to honor our very first caregivers. Those that, if you are still fortunate to have them in your life, will always seem to be sure and steadfast, knowing how to comfort when inside they may have no idea how to get through the situations in front of them. And I can speak personally from that standpoint. It cannot go unnoticed that after Mother's Day, it's led us into Nurses Week. And my goodness, where would we be without our nurses, especially now? Nurses have always contributed to the whole wellness of our beings. They are here for our first breaths, and they are here for our last breaths. They hold our hands, they dry our tears, they deliver medication, they provide answers and comfort, and to the patient and to the family. Now, when access to hospitals is so limited, when patients either affected with COVID-19 or cancer or heart disease, or one of many other afflictions that could lead you to a hospital stay. Now more than ever, nurses seem to have been highlighted. Not only are they professional nurses, but they are also taking on the role of a personal caregiver and friend. To all the nurses, thank you, because where would we be without you right now? To our residents in the county, with the number of cases that are showing improvement, we cannot become complacent. Over the weekend, it was announced that there were 2 cases in 2 of our smaller communities across the county, Southwest Middlesex and Lucan and Biddulph. Those numbers show us that the virus is still out there and it is still moving. As Ed said, we still have to follow the protocols that have been laid out for us by public health. Wash our hands, physical distancing, all those measures need to be adhered to. As I keep saying when I visit with you on a weekly basis, it's hard work, but it is paying off. And as businesses begin to reopen for curbside servicing, please remember to support those that continually support our communities. And remember to always keep it local. And with that, I'll turn it over to Dr. Mackie.
Oh, Dr. Mack, your mic. Thank you very much, Warden Bughardt-Jesson and Mayor Holder, for recognizing Mother's Day, Nurses Week, and the fact that my microphone was turned off. Appreciate all that very much. We had a fairly positive weekend in terms of case counts, deaths, locally and provincially. Locally, we saw our first day of zeros. Thank you to all those who were able to help get that message out, very hopeful. Both 0 deaths and 0 cases reported on Friday, which was public Saturday. On Saturday, we had 5 cases, and on Sunday, we had 13 cases reported. So we knew that 0 was not going to last, and sure hasn't. But we actually had 0 deaths over each of those 3 weekend days. So that was very positive as well. Provincially, 3 good days as well. Each of the last 3 days in the range of 300 cases across the province, which is quite low compared to the recent history, and continues that long-term trend that's been in place for about 2 weeks now of the 5-day moving average decreasing the case count each day. We also saw the first really significant decline in the death counts provincially as well. That 5-day moving average declining in the most convincing way since the beginning of this pandemic. This is the time where we need to continue as much as possible to respect the personal safety measures and physical distancing that we have. We are almost there. The light is very much at the end of the tunnel. We are approaching a time where our society will start to open back up to normal. We can get through this. We can finish it. We need to steel our resolve, keep going for a few more weeks. That's it for me for now, Dan.
Thank you very much, Dr. Mackie, Warden Bughardt-Jesson, and Mayor Holder. All right, let's get to the questions. There are a bunch in the queue. And the first one, Dr. Mackie, is for you. It's from Steve Young at CTV News. It's actually 2 questions. The first, given that we have already seen positive cases locally at grocery stores and fast food restaurants, should food services workers be required to wear masks or other PPE, and why haven't they been yet? And then the second question, with some businesses reopening and others slated to open gradually, what safety measures are you expecting employers to put in place that will ensure the safety of both staff and customers?
So on the point of food service workers at grocery stores and fast food restaurants, I would note that we have had cases of food service workers that have been sick, but we have not had any cases of illness that have been linked to those. In other words, although there is a risk of the disease potentially being transmitted through food that's been prepared by somebody who's ill, we haven't seen that yet here in Middlesex and London, which is very encouraging. And it suggests that that risk is relatively low. Of course, there are measures that are in place in all food service establishments in terms of doing their best to isolate and to make sure that people who are ill are not working. But we often find that people aren't perfect, and often you may start a shift and be asymptomatic, and by the end of the shift be symptomatic. So that is something that we know will no doubt happen again, and it's something we're monitoring closely. But at this point, there hasn't been a real strong intervention in that setting that we know would make a difference. The question of masking is an interesting question, and it is something that I think our society is going to have to grapple with. And as I've mentioned before, I'm on the provincial public health measures table, and it's the sort of thing that table will look at in terms of recommendations for recovery. It may be that there are stronger recommendations that come out around whether masking is appropriate in that sort of setting or other settings where people have to be in close contact with others. I'll just mention a somewhat related question related to the case finding and contact tracing that we did in association with those food service workers. And it's a reflection actually on a question that Warden Bughardt-Jesson asked earlier today. The question was around contact tracing for those who have been in close contact with a diagnosed case. As we have the illness being diagnosed in new communities, people want to know about, were they exposed to those individuals? Do they have any risk, and should they be doing anything to make sure that they are safe? The Middlesex-London Health Unit and public health across the province is mandated to follow up with every contact, every close contact of a person who's diagnosed positive with coronavirus. Close contact has a specific definition. It's about half an hour face-to-face contact or some other contact with somebody who is quite ill. For example, a healthcare worker who, for some reason or other, there's a breach in the personal protective equipment. Maybe their mask falls off for some reason when they're in contact with somebody. But you've got to have, or living with somebody who's positive would be considered close contact. You've got to have a really strong amount of contact. Passing by somebody in a grocery store or walking down the street wouldn't be considered adequate to cause your risk level to increase. And so in the vast majority of situations, we're able to work with the person who's diagnosed positive to make sure that we can trace all of their contacts, their close contacts, and ensure that each of those people is isolated, has education about what symptoms to look for, and gets tested right away if they do have symptoms.
All right. Thank you very much. On to the next question, Dr. Mackie. This one is also for you from Steve Young at CTV London. Half of the COVID-19 outbreaks in area long-term care or retirement homes have been ongoing for more than a month. Is there an end in sight?
Yes, so in long-term care and retirement homes, well, in general, in outbreak management, we're very quick to declare an outbreak when there is a justification to do so. We're very slow to remove those outbreak declarations. One thing that's fairly consistent in many public health outbreaks is as soon as you declare the outbreak over, you end up having additional cases. And so what you really don't want in terms of staff policies, procedures, and even for residents and visitors is you don't want to be flipping in and out of outbreak back and forth. It can be quite confusing. And somebody might hear the outbreak is over and then it gets declared again and they go in not realizing it's been redeclared. So we're very cautious to make sure that we are not declaring an outbreak over until it's very clear. That really has to do with the number of days that it have passed since a new case. And so if you have a situation where there's a new case popping up each week, it might not be that there's a large outbreak, but that it is continuing to propagate. That's why you would see those outbreak declarations remain in place.
All right. The next question comes from Dan Brown at the London Free Press. Dr. Mackie, this one is for you as well. The London area added 13 more cases today, a dramatic spike after slowed growth in new cases over the weekend. What do you feel accounts for the single-day surge?
Yeah, so the 13 count today was certainly not what we were hoping to see, but it isn't a big surprise either. One of the things that happens is the labs are batching both their testing work and their reporting work. And so it may be that these tests all came in over the last 4 or 5 days, but the lab was able to batch them, get them all done, and then had the time over the weekend when the testing volume decreases to start reporting those out, make sure that they get into the hands of local public health, and we can do that case isolation, case management, and the contact tracing. So we've seen this a couple of times over the last couple of weeks where we do get a spike in cases on a Monday after those tests get processed, and the labs are able to contact us over the weekend. And so not what we were hoping to see, but not particularly surprising either. And if you look at, again, that 5-day moving average, it really doesn't have a huge impact. We're still, in the range of 5 or 6 over the past 5 days or so. So, another good sign that it's not time to let up yet, and that the public health measures that we have in place need to continue strong.
All right, and a quick follow-up to that question, Dr. Mackie. Are single-day outliers to be expected as we move through the downward slope of the epidemic curve?
Yes, I would say that that's an accurate statement. We will have single-day outliers, and in particular in our region, because our we are doing in the range of 600 tests a day, but the percentage positivity is quite low. And so that means the case counts are low, and that means they're not as stable day to day as, say, the provincial numbers, where the trends are more stable simply because you have a larger data set.
All right. Another question, Dr. Mackie, from Dan Brown. Are the COVID-19 hospitalization numbers in London's hospitals over the last few weeks more or less than you were anticipating?
Yeah, the hospitals here in London have been in a pretty good position, and their capacity is remaining pretty stable. So it's below what some of the more dire predictions were predicting in terms of the number of hospital beds that have been filled by COVID. Or the ICU beds have been filled by COVID. There remains a lot of capacity in the system, which is great. And that's why you're starting to see discussion of the hospital system starting to open up surgeries and other hospital procedures as the capacity is available, and it's clear that it will be available for the foreseeable future.
Our next question comes from Grant Demi at My FM Radio in Strathroy. Dr. Mackie, there seems to be a trend of COVID-19 cases being more common in women. Locally, 62% of the cases are women, and provincially, it's 57%. Do we know yet why the coronavirus seems to be more commonplace among women? Is biology at play here?
So, well, it's all biology at one level or another, isn't it? But the coronavirus, interestingly, was initially more prevalent in men, and that was particularly from the data from China. The assumption there was that it was related to smoking rates, and here in Canada we don't have the same distribution of smoking rates. In China, there are much more men, about twice as many men as women, who are smokers. In Canada, that's not necessarily the case, and in fact, in some demographics, you see more female smokers, but that's not a trend that we would generalize across the population. It's not clear yet why in this region and in this province you're seeing more cases in women than in men. Is the short answer.
Okay. Sophia Rodriguez from CBC London has a question for you as well, Dr. Mackie. Is the jump in cases today of concern to you? Is there a reason why we saw so many cases today? And she mentions in her question a backlog of testing, and you mentioned that earlier. Are we still on track and on the back end of the epidemic curve?
Yes, again, looking at those 5-day moving averages, it's still clear that we are on the downslope of the epidemic. And the case numbers continue to decline provincially, and our average here in London and Middlesex continues to gradually decline. Also very encouraging, as I mentioned, about 3 days with no deaths at all, Friday, Saturday, and Sunday. So that's a very positive development, first time that's happened in quite some time. So I would say we're definitely continuing to see an improving picture, but not out of the woods yet.
All right, and your answer there is actually a great segue to the next question, also from Sophia Rodriguez at CBC London, and she notes as well that there have been no new deaths to report since last Friday. Have we peaked in deaths? And this goes back to something we discussed last week as well.
That's right, and locally it's very difficult to say simply because smaller numbers, and when you get to death counts relative to case counts, it's much smaller numbers, so it will bounce around. But the provincial numbers, it seems to be that we are seeing a decline in the death rates provincially. The last 3 days have seen a reduction in the 5-day moving average each day across the province. So that's quite encouraging. I wouldn't say that we'll know that for sure we'd want to see at least a week of declines. So I would say that, by the end of this week, we'll have a better sense of how stable that reduction in deaths across the province is.
All right. Dr. Mackie, the next question, again, is for you. It comes from Kelly Wong at Global News Radio, AM 980 CFPL. London and Middlesex saw 13 new COVID-19 cases today, but based off of MLHU's updated numbers, only one of these cases is in a senior care home. Are you concerned that community spread is becoming more common?
That's a really good question, Sophia, around community spread becoming potentially more common. On a related note, I think we're going to have to give all of you honorary epidemiology degrees because the questions are really coming in at a high level of sophistication. So thank you for that. So the question about sorry, now I've lost it.
What question?
That was Kelly Wong's question there down at the end.
Okay. So yes, thank you for noting that. 12 of the 13 cases today were from community spread. And what I would say is that that's just a further evidence that this is an issue of batching, because we really had seen very low numbers in the community spread column for many days. Community tests are being funneled to a different part of the lab system. The hospital lab, Palm Lab, is doing all of the hospital tests. The community tests are going through the Public Health Ontario lab system. And unfortunately, the Public Health Lab in London has been down for quite some time. The equipment is quite finicky, and unfortunately, one of the main pieces of equipment has been offline. And so that means that tests that go there to the Public Health Lab of London get essentially farmed out to either the Public Health Ontario lab in Toronto or the private lab systems. And so they don't have the same turnaround time. And that's probably why you're seeing, my guess is that those are primarily samples that went to the provincial lab in Toronto, and that the provincial lab was able to get to them on the weekend on Saturday and report them to us on Sunday.
All right. Dr. Mackie, we have a follow-up question from Steve Young at CTV London. We have seen in some restaurants that are serving takeout employees not wearing PPE and are working in close contact with each other. Is that a concern that they could spread COVID-19 among themselves?
Certainly. I mean, when you have people working in close contact, there is a risk of spread. And so any facilities where that is the case, and you can see in a kitchen environment where there isn't a lot of extra space, that might be something that ends up happening. So it is a potential risk, and of course is a trade-off, and they're providing an essential service we all need to eat. So there is some benefit there as well. Again, I think, you know, in the medium term, actually, we'll have to be more clear, and you will see guidelines coming out from the province. We're looking at local recommendations as well for places where there happens to be gaps at the moment. And some of those questions will have a more, systematic answer given to them over the coming weeks.
All right. Well, Dr. Mackie, Madam Warden, Mr. Mayor, the question well has run dry on this Monday afternoon. We are through the questions. I want to thank each of you for your time this afternoon, again, for bringing your unique perspectives to the discussion and for sharing your words with the community and those tuning in. We really appreciate it. And we look forward to the next time we can all be together. And for Dr. Mackie and Mayor Holder, that'll be tomorrow afternoon at 2 o'clock. And we'll see you then for our very next virtual media briefing on COVID-19. Have a great rest of your day.